The pandemic is not over. That is the urgent message coming from health leaders across our region. And tonight, as we welcome guests into our studio, we want you to know we are following the latest CDC guidelines with masking indoors, despite the fact that we have been vaccinated. Face masks on tonight with guests here.
Active cases across Northeast Tennessee topped 1,500 today. It's the highest active case count since January 28th. COVID-19 hospitalizations are increasing, and now we're dealing with the more contagious Delta variant. Good evening, everyone. I'm Sarah Diamond.
I'm Josh Smith, and no, none of us wanted to be doing this tonight, but we absolutely are monitoring coronavirus. In this special town hall presentation, health experts, school leaders from across the region are going to be joining us in the next few minutes. In fact, through the hour ahead to answer your questions about where we stand with the virus tonight. We're beginning with data released today by Ballot Health that sheds some light on where the region stands in the fight against COVID-19. Ashley Sharp joins us live right now from the Johnson City Medical Center. Ashley?
Hey, Josh, Sarah. Health officials said that our region is worse off now than last winter in the fight against COVID-19, and the data released today paints a clear picture. Right now, Ballot Health is treating 125 COVID-19 patients in its facilities. They say this number has tripled just in the last week. This time last week, that number was at 46 patients, and exactly 1 month ago today, it was at 20. Of the patients in the hospital right now, 33 are in intensive care and 17 are on a ventilator. Now, Ballot Health officials announced this morning that the current COVID-19 situation is worse than they anticipated. They're actually predicting that it could possibly be seeing 400 to 500 hospitalized COVID-19 patients just within the next few weeks. And that's going to bring us to our first question of the evening. This is for Ballot Health officials. One viewer wants to know exactly how many of the COVID-19 patients right now have been vaccinated. Josh, Sarah?
Ashley, thanks. It's a very good question, and we are joined tonight by Ballot Health President and CEO Alan Levine, Chief Infection Prevention Officer Jamie Swift, and Chief Physician Executive Dr. Clay Runnels. Thank you so much, all of you, for being here tonight. They are answering your COVID-19 related questions that are submitted by viewers. Jamie, let's start out with this. Can you tell us how many of those who are hospitalized with COVID-19 have their vaccinations?
We routinely assess that, and every time we look at those numbers, we are running about 95 to 97% of our hospitalized cases are unvaccinated. So it is a very small percentage of people who end up with COVID that requires hospitalization after being fully vaccinated.
Now, we know from experience, as we think about the last time we were dealing with a major surge, that this had an impact on the other types of care you felt safe providing because of the need to make sure that there were beds available and machines and doctors available. To you, Alan Levine, with the increase in COVID-19 hospitalizations, with a staffing shortage that you've been very open about, where do you stand in terms of surgical procedures?
Well, you know, I don't think it'll be a surprise to anybody that we're looking at having to curtail surgeries that are non-emergent. Today, Vanderbilt University Medical Center announced that they were doing the same thing. I saw a story today in Baton Rouge, Louisiana, where COVID patients that were on their med-surg floor they went down, they crashed, and they needed intensive care beds, but they were full. And you know, I don't think we have to play a guessing game here. We are seeing this play out everywhere else that has beat us to this surge, and now it's here. And I think we can expect, as I've said, longer ER waiting times. I think that we can expect capacity issues, and we're very concerned about it. So I do think that there will be some limitation of surgical procedures that are non-emergent.
So far, none, though. No delay or pause on elective procedures for Ballot tonight?
Not tonight, but we're looking at it very hard over the next few days. As if you look at the tripling, I mean, we've seen our volumes triple in 1 week for COVID. If you think about it this way, we had 100 patients in our emergency departments waiting for inpatient beds, non-COVID patients. We had 125 COVID patients upstairs. So you could see it's beginning to displace services for other people who need it timely as they wait for beds and for staffing. So this is just the beginning. We're only a week into this, and I think if we start to get to a place where we get more than 200 inpatients, we've got a real problem.
Dr. Runnels, I'm going to direct this question toward you. Where do you think our region is headed as far as fighting the virus goes? I'm sure you've been talking for a very long time with staff about a surge plan. Where are you with that?
Well, I think that's something that is an ongoing process. Well, I think one thing to realize is that we've never really stood down our emergency operations stance. It's been stood up since last spring, spring of 2020. And so we have been monitoring the pandemic and working on a regular basis on matching capacity with the need for infected patients that are coming in with COVID-19. So we meet daily and try to match our resources with the needs.
And to you, Jamie, real quickly before we head to a break, I think a lot of people tonight are trying to say, okay, wait a minute, maybe I should get the vaccine. If you got the vaccine tomorrow, what should you do next?
If you get the vaccine tomorrow, keep wearing that mask. That is the most important thing you can do. Get your vaccine tomorrow, get your next vaccine in 3 weeks. You'll be fully immunized and fully protected 2 weeks after that.
So you need to maybe be curtailing your plans to be out in the public, I would think, if that's the case, right?
You know, I can tell you that I have certainly made adjustments to my behavior. We are not going out as much. We are pulling back from any large gathering, and so we really are at that point that we're asking the public to think about their risks, to think about the crowds and what measures will be taking place.
May I add something about the vaccine really quick? You know, the combination of the vaccine and the mask wearing is really important, because the mask wearing, it's a barrier that prevents you from spreading. If you might have this virus and not know it, and if you're around people and nobody's masked, that virus is spreading very rapidly. And the mask is a short-term barrier. While you get the vaccine and build immunity, you're protecting yourself and you're protecting the people around you. It's not one or the other. Both are important. Vaccination, though, is the most important thing we can do to stop this thing.
All right, we are talking with our medical experts from Ballad as we kick off monitoring coronavirus. We're going to take a break and we'll be right back. Stay with us.
Well, of all of the things that you can do to protect yourself from COVID-19, health leaders from the global level to right here at Johnson City Medical Center are all overwhelmingly saying that the best tool in fighting COVID-19 is to get the vaccine. Now, Ballard announced today that across its 21 county service area, just over 37% of its population is fully vaccinated. I spoke with dozens of our viewers this week who have not received the COVID-19 vaccine, and their reasons vary for why they're choosing to not get the shot. One person told me it was a fear of needles. Many say they simply don't trust the science.
You come up with this vaccine in 6 months? No, that's not enough research for me.
2 of our kids cannot be vaccinated. They're still too young. And it's kind of like you're picking and choosing. Well, I can protect 2 of my children, but I can't protect the other 2. And so, yes, as a family as a whole, we just feel like we should all go in and be vaccinated, or none of us will be vaccinated.
And to address concerns and questions about the COVID-19 vaccine, we're going to send things back to the studio where Josh and Sarah are live now with Ballard health officials.
Thanks, Ashley. And that's a common response to both of those reasons for not getting the shot. So, Dr. Reynolds, let's start with you. What do you say to those people who don't trust the science? Hey, 6 months is not enough to make this vaccine, safe for everybody, and those who have the all or none mentality. I know it's kind of a two-part question.
Yes, well, to the first part about the development of the vaccine, I think what's important is the steps that are taken to develop that vaccine, not necessarily how long it takes to develop it. And I think the thing that often gets forgotten is that there were no steps that were skipped in the development of the vaccine. It went through all the stages. They cut down some of the red tape and streamlined the process, but there were no steps skipped. The mRNA vaccines now have not only a very large study that started the development of those vaccines, but we have more than 100 million people that have received those vaccines. So we have a body of knowledge there that proves that these are safe and effective vaccines. And I, like the viewer, wish that my youngest could be vaccinated as well. However, I think that also speaks to how careful that officials who are watching the development of the vaccines are being. They want to make sure that they have the dosages right. They want to make sure that they have any effects that are unique to children fully investigated before they approve it. So I think that just speaks further to how careful people are going within the with the development of the vaccine.
May I add something
Absolutely,
to that?
yes.
So the science behind the mRNA development, the technology there, has been studied for decades. So what the science behind the development of the mRNA vaccines, which is Moderna and the Pfizer vaccines, is not new science. Secondly, another myth that I think has prevented some people from getting the vaccine is this rumor out there about infertility.
Yes.
And a lot of women are concerned about that. And the American College of Obstetricians and Gynecologists and the Society for Fetal Medicine have both come out strongly advising women to get vaccinated. A bigger threat to a woman's health is if they get COVID. There's no evidence at all that the vaccines affect fertility for men or women. And so there's been a lot of information out there and I think people are trying to make the right decisions for themselves and their families. And there's just so much information out there. They're being cautious, which all of us, I think, understand. Our job here is to try to dispel those myths, which are frankly, in many ways, harmful.
Jamie Swift, the variant, we used terminology that 2 years ago none of us would have known what we were talking. What are you talking about? A variant of a virus. This is COVID-19. It's figured out a way to move faster through the population. Is it more dangerous? Are you seeing patients coming in? You mentioned, I think, Alan, at a news conference, they're presenting sooner. So they're getting sicker faster, but is it a more dangerous version of COVID-19 that we're seeing?
There's still a lot of information to really understand about this variant. We absolutely are seeing patients present faster, and right now it does seem that they are presenting with more severe symptoms. What you're seeing now are younger patients who are extremely sick, and we did not see that with that first strain. You saw more of that elderly population. And so now we're truly seeing the people coming to our hospital, as evidenced by our numbers, are younger. They're extremely sick. We're talking about, very young people on ventilators, really struggling for their life right now. So we're extremely concerned about just how transmissible and how serious this variant is.
We are talking with medical experts from Ballad Health for this segment. After the break, we're going to talk children and COVID-19. Does the Delta variant pose a serious risk to kids? We kind of started getting into this. We're going to go more in depth with our health experts.
First, if you are not yet vaccinated against COVID-19, here's a look at the operating hours of Ballad Health's Community Vaccination Center. This is Monitoring Coronavirus Town Hall on News Channel 11, airing live as well on ABC Tri-Cities. Coronavirus Town Hall. Our panel has changed a little bit. We're joined by Lisa Carter. She is the CEO of Niswonger Children's Hospital, where tonight they are on alert because of what's happening in our area. Let's go back to you, Dr. Reynolds, real quickly. So many of us have little ones under the age of that they're eligible for a vaccine. And bye, sweetheart. Have a good day at school. What is your advice to parents tonight who have little ones, you have one, who can't get vaccinated because they're not age eligible?
Well, I think going back to the all or none discussion that we had earlier, I'd like to add to that being able to vaccinate others in the household does affect the young one as well. It will protect them because many of the infections that we see in young people also start in the household. And so having as many people vaccinated in the household as possible is important. But from a standpoint of going off to school, the American Academy of Pediatrics has supported masking. And so we still support that. We recommend that masking in closed environments like schools and classrooms. We think that's important to protect not only the individual but other kids in the classroom as well.
We are really seeing this variant, it's kind of switched the script a little bit about what we first, when this came out, we were worried about, older people, very young, but then we found out that maybe the elementary school age kids, they were doing okay. But now that this Delta variant's here, it seems like our younger ones, because they can't get vaccinated and because it's coming on a little bit more swiftly and maybe stronger in some cases, they are the vulnerable ones now. So are we looking for faster? Are we looking for same symptoms in our children who can't get vaccinated as we are in adults?
You want me to take that one?
Sure.
Lisa?
Yeah. Well, I
Either
think
way.
you're correct. That is a group that we're very concerned about, and actually 22% of our positive tests right now are in the pediatric age range. Just like the adults, we are seeing a faster onset of symptoms. For the most part, though, the symptoms are similar to what we've seen with the other variants we previously encountered in the pandemic.
Lisa, you're at Nicewater Children's Hospital. You know to the bed the resources that you have. As Sarah said, switch the script a little bit here. Are you concerned about the ability of our region to respond to a flood of really sick kids if that happens?
I am extremely concerned. You know, it was interesting when the pandemic started initially, you know, back in March 2020, we as pediatric hospitals started surge planning as well, and then all of a sudden it became evident that we didn't need our beds for kids. We needed to shift and think about how we could support the adult side. And honestly, probably about 2 weeks ago was when we first started realizing, wow, this is very different now. This is very different. We absolutely have to create plans for surge for kids, because we started monitoring what was happening in our emergency departments, and we started seeing more and more kids coming in. Really, things started shifting around in about June. We started seeing more RSV, which is also a respiratory virus. That usually follows flu season and doesn't happen until later on in the fall and winter months. And all of a sudden in June, our pediatric hospital was full and holding patients in our emergency department because of respiratory illness. Then comes the Delta variant on the scene, and now all of a sudden we also have COVID admissions in the hospital. And so we're very concerned. We're concerned about capacity. We're now creating surge plans along with our adult partners and working in collaboration to figure out how we're going to increase capacity on both sides of the house.
I can't begin to tell you how concerning it is to think that we could have children that come to the hospital that we're unable to get to because we only have so many intensive care beds and there's only so much staff. We're trying to hire additional labor right now that are intensive care, pediatric intensive care nurses to prepare for what we believe is going to be a surge based on what we're seeing everywhere in children's hospitals all over the country right now. I think back to the previous question about the masking, you know, the number one thing you can do for your children that are 12 and older is get them vaccinated if you haven't yet. But the reason masking is important, particularly when they go into closed environments, indoor environments, these young kids below 12 are not vaccinated and they are exposed. And you know, we ask parents to put their kids in seatbelts. We put fences around swimming pools. We do a lot of things because the evidence shows if you do those things, it's a barrier to something bad happening. In this case, having a barrier to protect a child from spreading a highly contagious virus and protecting the other kids, not just your child, but the other kids, it's the only protection they have in a closed environment. So I think getting the vaccinations combined with protecting and creating a barrier so that, and listen, I know people are not happy about masks. I'm not either. And I certainly know that they're concerned. Anybody that expresses concerns about the mental health effects and all the other things that come with wearing a mask, that's the least, all the options are bad here, okay? That's the least bad option. A worst option would be if we have to start closing schools because you have an outbreak. And it's happened in Mississippi. A week after school opened, they ended up having to close them. And no one wants distance learning anymore. We want these kids in school, but we got to get through this virus. And if the worst thing what we don't want to be doing is talking to parents who have their children on ventilators or worse. And it's already begun. And we've had those conversations, and they're very difficult.
We understand you're trying to reach retired nurses?
Yes.
And I think we have a phone number. Who needs to call this number?
If you are a retired nurse or any type of, if you worked in healthcare, it's 423-302-3299. We will welcome you back. You don't have to do direct clinical care. You can help with discharges, but our nursing staff needs help, and we would certainly welcome having it.
All right, we are going to take a break. We will be right back monitoring coronavirus. You are watching Monitoring Coronavirus, a News Channel 11 ABC Tri-Cities Town Hall special. As this new school year is kicking off, many parents are concerned about their children's safety due to the increase in COVID-19 cases across our area. And as we welcome our guests into our studio, we are following the latest CDC guidelines about masking indoors despite vaccination status.
I want to welcome in our next two panelists. This is on the far side of your screen, Greg Wallace. He's with Johnson City Schools. He's the Director of Safety and Mental Health, and Washington County, Tennessee Schools Superintendent, brand new on the job this year, and I will call it a baptism by fire. This is Jerry Boyd. Welcome to both of you here in the studio tonight, and your willingness to answer questions here as students go back to class around our area. First question coming up here. Many schools are talking about those mask policies.
Yes, because everybody's been talking about it. School systems have been saying, okay, this is what we're going to do, and it's changed. It's different as you go around our region. Now, despite warnings from lawmakers, Hancock County announced yesterday that they are going to make masks a requirement in their classrooms. Do you see any other school systems right now following suit, including your own?
Well, certainly we're going to continue to watch the conditions. Right now we're still staying the course on masks being encouraged but optional, and our families making a decision, our employees making a personal decision. But it could change.
Mr. Boyd, you are working with students in terms of their safety and mental health, and what a crossroads that places you in. We've heard from lawmakers very stern words that they don't want to hear about mask mandates, they don't want to hear about virtual learning, and now you're having to figure out, okay, how are we going to do school? Right. So what is your message to parents tonight as they are putting the kids out the door in the mornings? Are you urging them to urge their children to wear masks? What are you saying on that side?
Yeah, so what we said is that we encourage, we're using the same language that the city is using, that we're talking about the CDC recommending mask use, certainly within buildings, particularly for those that are unvaccinated. And we want people to feel safe. I know that we've had some principals that have modeled that. We went around to schools today. There's about 24%, 25% of our kids that were wearing masks. So we did have a number of folks that were doing that. Some of our principals were doing that as well. And we want people to know that we're doing what we can in the schools to make sure that they feel safe. And we still have lots of protocols in place. It's just we removed the one mask mandate.
And this begs the question, and I don't mean to put you on the spot here, but the CDC is saying regardless of vaccination status, masks should be worn indoors. Some parents are wondering, okay, so why aren't the school systems going along with this? Why are they saying it's recommended or optional or encouraged? And I know that's a tough question.
Well, I mean, it's one that we've heard, and certainly we just had a board meeting. We had parents from both sides. Our board was able to listen to both of those sides, and they made the decision that they wanted to make parents to have the opportunity to make those choices on their own. So it is a very difficult thing, and like Dr. Boyd mentioned, we are certainly monitoring it. We talk regularly with our partners at the health department. They've been a great resource for us, and we continue to listen to that, and hopefully things will get better. But we also have some other things in place, like some additional testing that we can do at the school with parental consent and things like that, and able to hopefully to keep students that are symptomatic out of the building.
Mr. Boyd, it sounds to me like there is very little tolerance for the idea of kids going back home and schools. Is this an accurate read? And why is this such a priority that we get kids back in class?
Well, I think obviously we see some strong data that shows in-person learning opportunities are much stronger than a remote setting. That's the main reason. We've spent the past year dealing with a lot of differences of access and inequities, and the best way we can ensure equity and access is our students having in-person learning opportunities. So that's the urgency of maintaining that in-person learning. And we realize too, with the mask conversation, those go hand in hand, but we also we want to encourage everyone, our parents especially, to get all the information they can and make decisions about their own children as we provide that in-person learning opportunities. And I certainly will encourage those that are eligible to get vaccinated that haven't. They should consider it. They should consult their medical professional that they go to and decide that for themselves. And then the families certainly should talk within themselves and decide how they're going to handle it. And then we have, as Dr. Wallace, he mentioned, we have individuals that are modeling that. They have a concern and they're wearing masks themselves, and I think more and more will begin to do that. So we're putting the opportunity to the individuals and the families to make these decisions.
All right, we are going to take a break. We will be right back with Monitoring Coronavirus. Stay with us.
You're watching Monitoring Coronavirus, a News Channel 11 ABC Tri-Cities Town Hall special. Now, kids all across the Tri-Cities region are heading back to the classroom, and as they return to school, many local parents are concerned about the spread of COVID-19 and how that's going to impact their kids. We asked some local parents to submit their questions ahead of the school year.
Hello. We have learned that the Delta variant of COVID-19 is affecting children more harshly than the other variants are. And my question is regarding why are we not being more proactive in terms of mitigation strategies and prevention strategies instead of being reactive? Thank you.
And for the answer to this question, we're going to send things back to the studio where Josh and Sarah are joined now by school officials.
That's a great question. Let's get into mitigation. What's being done as of right now? I know it's changed a little bit, but as of right now, what's the mitigation so far?
In Washington County, the one difference is the mask requirement, and I'm sure that's consistent across the region and in our school districts. All the other steps are still in place. Mm-hmm. From as much as we can, the social distancing, but certainly the practices of sanitizing our areas and just using good hygiene and encouraging that. And then the response we have when we have people with symptoms or they're suspected to have been exposed or COVID positive is relatively very similar to what we have done in the last 18 months.
Dr. Wallace?
And I would just add to that, it's exactly the same except for the mask mandate. And again, masks are optional. People can wear those. They're encouraged to do. We mentioned people are modeling that. But one big difference this year that we have that we didn't have last year is the ability to test at school. So last year, if somebody was a potential positive, they may be out for 10 days regardless if they had 2 minor symptoms, 1 major. This year, they've got 3 avenues to come back quicker. They can have an alternative diagnosis from their physician. They can be tested by their physician with a negative test, or they can be tested with parental consent at the school, and if those are negative, they're able to come back. So that's another big piece that allows. So when people say There's no mitigation strategies. There are some, they're just a little different than what they were last year.
Last year, there were whole swaths of school populations being taken home because they were contact traced and were seen to have come into contact. That was a different variable depending upon the school district. Are you going to be doing that again this year? We'll pose that question to Johnson City and to Washington County Schools. Will you be doing that active contact tracing and just sending kids home, even if they've been vaccinated?
So not the large swath. So obviously vaccinated people that have been in close contact would not be required if they're symptom free. People that have dual mask on would not be required to be sent home. So we have some of those options that will not allow us to take so many people out. And I think that was a frustration for everybody. It certainly was a frustration for us as a school. Anybody 6 feet, 15 minutes. We felt like having that control at the school level made sure that we were only getting those students specifically that were involved by that. We're certainly deferring some of that to the health department now, but we're gonna certainly assist them when we can.
How about you, Mr. Board, Washington County? Will you be contact tracing, quarantining kids who've been exposed?
Well, the bulk of the contact tracing will fall to our health department, but we're going to participate and support in the way that we can. Definitely take action in monitoring symptoms. Our school nurses using their professional judgment in their interactions in the school every day, just to monitor the symptoms and take action when we need to.
This has been going from last year to, okay, the cases are down, let's change again, to now the cases are rising, you're changing again. You've really had to adjust quickly to pretty much any kind of situation, depending on the number of COVID cases.
Yeah, and I think there's two things that are universal. One, we all agree, regardless of where you fall on the spectrum, that we all want students in school, right? And we all want students safely in school. So different people have different opinions on how that happens, but we all want that. But it certainly has changed. I remember in May we were having a discussion, aren't we glad we're not going to have this discussion next year? And we are having this discussion, but we still want to make sure parents feel safe and know that we take it seriously, we monitor the situation closely, and we discuss closely with our regional health partners as well.
Dr. Greg Wallace, Jerry Boyd, thank you so much for joining us tonight. We have more after this break. Stay with us.
Officials here at Ballad Health and officials also with our local health departments are keeping a very close watch on the recent uptick in COVID-19 cases here in the region. They're consulting often with local government and school leaders and offering recommendations on how to best deal with the virus. Now that we are in this
with the Delta variant, is the risk to children different than it was last year? And what should schools be doing in response?
Now for the answer to this question and more, we're going to head back to the studio where Josh and Sarah are live now with area leaders of health departments.
All right, thank you very much, Ashley. I know the two of you are thinking, wait a minute, that's a schools question, and the schools folks just left, but we're going to put you on the hot seat anyways. We welcome in Dr. David Kershke with the Northeast Regional Health Department, Sullivan County Regional Health Department Medical Director, Dr. Stephen May. Thank you for being here, both of you, tonight.
Great.
Let's tackle that question, why don't we?
Yeah, let's do it. What should schools be doing in response with this Delta variant? Have you given any advice to school systems?
Yeah, so we do know that the Delta variant appears to spread more rapidly. You've also heard that it's affecting children more from some of our children's hospitals. With the goal of kids being back in school in person, we need to really give our school officials all the tools they need to be able to do that safely. So we're encouraging vaccination. Our health commissioner has said local school boards have the authority to require masks. It's up to local school boards. As a health official, I'll certainly support every school system in our region that's doing anything to help protect our kids. We'll be behind them 100%. And like I said, our health commissioner has said that it's the local school boards that have the authority to recommend or require masks.
Dr. May, in the darkest days of last year, I think I'm like a lot of people, and that the one solace for me was my kids are going to be okay probably. Even if they get it, they're healthy, they're going to be okay. From you, is this more dangerous for children, this variant of COVID-19 that's now moving through our community? Are even healthy children at serious risk of serious illness?
Well, the answer lies in the data, and the data shows that during the initial Wuhan strain that moved through particularly strongly in December of last year, we had very, very minimal children with requiring hospitalizations. We did have a few that developed a very specialized condition called MIS-C, multi-inflammatory syndrome in children, that we were starting to see, but we've not seen very many cases of that. With this variant moving through, we have started to see increased numbers of children requiring hospitalization and severe care. So that is indeed different, and we've heard from Ballad about their pediatric intensive care unit now being challenged, beds being full, and it's not just here, it's in Memphis, it's in Nashville, and we look at other states, we can look at the data from the United Kingdom, and they did see increased cases in the pediatric population. So it only stresses even more that we follow the safety guidelines. We know what works. We know masking works. We know distancing helps. And now we have a tool in our toolbox, two tools. We have the ability to test in our schools and to test widely within the community. That was a major challenge last December, just even knowing where the disease was. Now we can rapidly identify the disease, and we know the safety measures we need to take, and we have this miraculous vaccine that is so protective. You were mentioning earlier about the breakthrough incidence, and so I took a quick moment and calculated our breakthrough rate, at least with Sullivan County numbers, and it is 0.15% of those who have received vaccines, and we've given out well over 132,000 doses of vaccine just for the Sullivan County citizens. So the proof is in the pudding. The rate of breakthrough cases is very, very low, and we know that 98%, 99% of those who are hospitalized or are dying have not been vaccinated.
Yeah, I'll also add that if you look at the graphs of who's been vaccinated, older people vaccinated more than younger people. But then if you look at the graph of who's being infected now, school-age kids and college-age kids represent most of the cases right now, whereas our older population, the least amount of cases.
All right, we're talking with our area health leaders from health departments. We are going to come back and ask them a few more questions, but first we're going to go to break. We'll be right back. Stay with us. Channel 11 ABC Tri-Cities special presentation, Monitoring Coronavirus Town Hall.
Northeast Regional Health Department Director Dr. David Kershke, Sullivan County Regional Health Department Medical Director Dr. Stephen May are answering coronavirus questions submitted by you, the viewers, and we want to thank you both for being here. And we got a question during the break from a viewer who wonders, is there a vaccine that's more effective against the COVID variant called Delta? Dr. Kershke.
Yeah, so I would say we don't have enough information, but what we really do know is that if you're not vaccinated, you're at 12 to 30 times the risk of becoming hospitalized if you get coronavirus. So really it's vaccinated versus unvaccinated that's the most important question. So if you have a chance to get vaccinated with any of the 3 vaccines, we encourage you to do that.
When numbers started falling, then testing went down, testing sites closed. With the surge coming, any plans to open any testing sites like the big ones that we had?
We're in our region, we're open 8 to 4 every day at any local health department. You can go get tested. So far, we haven't needed to do a surge, but if we do come to that, we can do that. There's also lots of places in the community everybody can get tested.
All right, Dr. May?
And that's the difference is in December, we were just getting widespread testing started, and the health department was one of the only few sources for that testing. Now we have widespread testing in multiple outlets that you can get tested. We do have drive-through testing in our emergency plan should the public demand rise to a level that we need to reopen drive-through testing. And we provide Everly Well testing, which is just a take-home test that anyone can come to the health department and receive that and do their own test.
Yeah, what we'd really love to see is the demand for the vaccine increase so that we open up our big mass vaccination clinics again.
Is that an option?
Yeah, we definitely would be thrilled to be at that point again where we're given that much vaccine.
Dr. May, Dr. Kershke, both of you, quickly, how concerned are you that we could be seeing a variant surge that could so dramatically impact our local hospitals and doctor's offices that we're not able to provide care to patients who walk in the door and need it. How concerned are you about this tonight?
Well, it's a major concern, and we've looked in over a period of 2 weeks. We've gone from 2 to 3 cases per 100,000 to this morning we're at 23.1 cases per 100,000 just in Sullivan County. And we've watched our positivity go from less than 5% to over 20% in just less than a couple of weeks. And this tells us that we have rapid, basically rampant spread of the disease within our community. And we know that we have a fixed rate of hospitalization as we've gone through. That's about 4.7% of people who become ill wind up hospitalized. We know about 1.7% of those who become ill will die. And these numbers now are all preventable with the vaccine.
Yeah, and with a doubling time of just weeks, it starts out small, but now it's starting to really, the numbers are starting to jump in an alarming way. And all of us in public health are, very nervous, very concerned about where this is headed.
More nervous than last year?
I would say yes. Just the fact that, we have such a large unvaccinated population in our region. Our vaccination rate statewide are just shy of 40%, people fully vaccinated. We have this Delta variant that looks like it's more transmissible. We're seeing the numbers double so rapidly that, potentially we could exceed what we saw in the wintertime if we don't take measures. And measures are at an all-time low. There's fewer people wearing masks and things like that. So, yeah, concerned.
All right, we are almost out of time now. I want to ask very quickly, what would you say to people who are like, okay, I've got the vaccine like I was supposed to do, I did everything I was supposed to do, and I still have to wear a mask, and I feel like I'm being punished for this. What would you say to them? Yeah, so the reassuring thing is that people that have been vaccinated are way less likely to become a case or be hospitalized, so it is protecting against severe disease. We can, with the Delta variant, unfortunately, we figured out that people can become infected and spread it after you've been vaccinated, even though you're unlikely to be hospitalized or have a bad outcome. Okay. So, we really need to protect those that haven't had a chance to be vaccinated yet. Children that are too young to be vaccinated, other people that just haven't made up their mind yet to be vaccinated.
Thanks to both of you, and we want to thank you and also health and school leaders who've joined us for this special presentation of Coronavirus Town Hall. I'm Josh Smith.
I'm Sarah Diamond. If you only caught a portion of our presentation or would like to rewatch it, you can find it a little later on WJHL.com. Have a good day.